Hey, Dr. Dondi, it's Dave from Respiratory Therapy. How you doing?
Hey Dave, how you doing today?
Good. I heard we have a patient coming in.
Yeah, we've got Mr. Jones coming in for a below-the-knee amputation.
Okay.
His past medical history is he's a quite severe diabetic,
Okay.
poorly controlled. He also has a history of asthma. He takes Ventolin and ipratropium as well for that.
Okay.
I've done a pre-op assessment. He has an IV in currently.
Okay.
He's got no history of DKA. His airway seems like hopefully it should be pretty easy. My plan is we're going to do an IV induction, and then once we get him off to sleep, we'll maintain him on some sevoflurane.
Awesome. What can I do to help?
Do you want to go and get the gas machine ready?
Sure.
Get my drugs ready?
Yep, absolutely. Okay. All right, let's get this gas machine ready to go. So, okay, first thing, I'm just going to turn this on here. Make sure everything's plugged in. Looks like we've got pipeline pressure here. Excellent. My tanks are down, so I'm just going to go around the back and make sure I got it. Okay, so I only got one oxygen tank, but I'm going to turn that on. Just verify that I've got the content here. So my oxygen contents are just under 1,000 psi. If I had an air on nitrous, I'd turn those ones on as well. Let me make sure I go and turn that back off so it doesn't drain. Okay, I'll leave the wrench. Just make sure my scavenger's all set here and ready to go. Put that on the minimum there. Active, open scavenger. Okay, that all looks good. Come back around and do this check. Alright, looks like we're fired up and ready here, so I'm going to do the self-check here. So seal the Y piece. So got my circuit in place. Looks like it's nice and tight on here. Put that there, good. And my sampling line, so that's this line here. It says it to occlude that, so I will make sure I occlude the sampling line. Number 3, install the manual bag. That's already installed for us here, good. Adjust all the flow meters to 0. So the flow meters all look like they're working okay. They're all at 0, good. Set the switch to auto. Okay, so it's my switch here in auto. Press the flush button to fill the bells completely. The flush button's down here. Push that and then flush my bells. Okay, so they're completely at the top. And it says to continue with my test. Alright, let's continue that. Alright, let's get the patient monitor fired up too. I guess while that's doing that, I can check some other things. I'm just going to make sure I got all my airway stuff ready to go. So, Mac 3 blade, bulb's nice and tight, lights working good. This second blade, it's a Mac 4. Got a number 8 ET2. I'll go ahead and check the cuff on that. Looks like it's holding pressure. Excellent. Okay. Let's see, I've also got a 7.5 tube just in case this one's a little too big. I'm going to go double check with Dr. Hunter how big this patient is. I got a couple of masks here. Looks like they might be appropriate size, some OPAs and Stylet. Excellent. Okay. Alright. The machine says it's passed, so let's continue on with that. And now we'll do the manual check. So we're going to adjust the APL to 50 centimeters of water. So my APL is this device right here. I'm going to turn that over to 50. And make sure my flow meters, yeah, they're still at 0. Good. Manual switch over to manual. That's this switch here to manual. And press the flush button until the gauge reads between 25 and 35. Alright, so here's my gauge here on this machine. Right now it's sitting at 0. So I'm going to try to push this flush button until it reads about 30-ish. Right there. You can see my bag's nice and inflated there. Okay, that's what I'm going to do now. Select continue, okay. Alright, well, while I was doing that, I'm just going to check my other system, so make sure my vaporizers turn on. Excellent. That one. Good. Make sure the lock of the mechanism's level looks full. That's good. Otherwise, I filled up. We've got an extra bottle of sevoflurane here. I'm gonna leave that here. My Sodarzor, just make sure my pellets look good. So I'd have to fill that up and make sure they're all nice and new and fresh. And from there, now it's telling me to adjust the level to SP. Okay, so if I come back here and put that SP in, that stands for spontaneous. Excellent. Okay, so I'm going to continue. Alright, so that looks like it's the self-check that's also done here. I'm just going to do a couple more tests just to make sure this is ready to go. Check my line pressure. I know I've got some oxygen back up in the cylinder. I'm just going to check my fail-safe, so in case we lose our oxygen, dial that on. I'm actually going to come over and disconnect the DISS oxygen. What I want to hear is an alarm and make sure that oxygen goes down. So you can see my pipeline's gone down, my flow meters. Oh yeah, there it is, O2 supply failure. And I'm getting the audible and visual alarm. Excellent. So if I reconnect that, because I don't want that to stay like that, it should go away. Make sure that goes away. My pipeline is repressuring. Excellent. Okay. Just want to make sure that my proportioning system works too. Yeah, good. So it won't let me dial any nitrous on because I don't have the option. If I put on 1 liter here, okay, so I'm getting good proportion in here. If I turn that down, good. So it looks like my proportionings work. I'm just going to dial that back down to make sure it's good. Everything's off here. Okay, good stuff. So my bellows are good. My APL's checked. My bag is checked. Circuit's good to go. I checked my airway equipment. I checked my contents of my cylinder. My oxygen fail-safe's working. My vaporizers are good. I guess all there is to do now is to set up for this patient. I need to know how big he is.
Dr. Hunter,
Yeah?
did you have a chance to see how much Mr. Jones weighs?
Yeah, he's about 72 kilos.
72 kilos, okay. Just want a volume ventilator and pressure ventilator, you have a preference?
Whatever you choose, I think. It's
You
easy.
said that he had a little bit of asthma. Was there any other lung conditions you were worried about?
He had a
or-
little bit of asthma, but his pre-op spirometry looked quite good, so I think you can just kind of treat him as normal.
Okay, good to know. Okay, I'll set up that ventilator for you. Gas machine's all checked out.
Alright, 72 kilos, so 6 mils per kilo. Let's do about 430-ish here. So I'm going to go ahead and start setting this up. My tidal volume, let's put it around 430. I'll let Dr. Hunter know what we're doing here before we get going. Set that. His rate, I'll start just something normal around rate 12, let's say. IE ratio, I'm okay with that. I don't really need a pause for now until I know anything different. Let's put that off. And let's do a bit of PEEP as well. Okay, that looks good. Set that. I'm just going to check all my alarms to make sure everything's okay here. Alright, so minute ventilation, we set 430 and a rate 12, so he's going to be moving about 5.5, so let's bring this up a bit. Bring that up to about 4. And hold that turn, accept that. Oops, sorry. If he's moving about that, we'll say high at 7. Peak pressure's on. He's an asthmatic, and we're gonna bring this down a little bit just to make sure he's in the safe zone to start. And then we'll adjust as needed. Anything else? Put that on. Okay, I think I'm happy with that. Let's just change this just to be sure here. Okay, I think I'm okay to go here. set up. It'll be easier when he just gets switched over to the bed here. So I'll just get these wires tangled. I'm gonna put my white lead on the right side of the bed here, and my black and red lead on the left side. And get a sock probe ready to go. I know where that is. I'm just going back there for now. And I need a blood pressure cuff. I'll bring that to the head of the bed and make sure I tuck that in here. Okay, I got most things ready to go.
Hey, Dr. Hunter, I think I got everything set. I got the bed all set up with a 3-lead ECG, a blood pressure, and a SAP probe. The vent set at volume control with a tidal volume of 430, rate of 12, PEEP of 5. Anything else you want done differently, or?
No, all your events set up and everything looks great.
Okay, I checked all the airway equipment.
Perfect. Do you want to go do an airway assessment on Mr. Jones?
Yeah, sure. Is he just out in the hallway?
Yeah, his bed's just outside.
Okay, I'll go do that now.
Mr. Jones?
Hi.
Hi, my name is Dave. I'm one of the respiratory therapists. I'm working with Dr. Hunter today.
Nice to meet you, Dave.
I understand he's been out and had a chat with you already.
Yeah, he came out and was trying to calm me down. I was a little bit nervous, so
Okay.
it's good to talk to.
Got your IV started here. Is this painful at all, or?
No, not at all.
Okay. Excellent. Before I start, do you have any questions about what's going to happen today, or?
So they're gonna put me to sleep, right?
Yeah. So right now, what we're going to do is we're just going to check out your airways. We're going to look in your mouth, around your neck, have a listen to your breathing, just to make sure everything's okay. There's a very small risk when we do the airway procedure that we could crack or chip a tooth. Just when we put that tube in with the, it's a device called a laryngoscope. It's a small possibility. I do have to let you be aware of that, though. Do you have any dental work, any crowns, any dentures, nothing that's going to loose or going to come out? No wiggly teeth? No? Excellent. Is it okay if I go ahead and just do a bit of an assessment on you then?
Yeah, that's okay.
Can you open your mouth as wide as you can? Say ah. Stick your tongue out. Excellent. Okay. Just gonna feel your neck here. No pain around here?
No.
Okay. Can you put your chin, your neck all the way back? Now can you touch your chin to your chest for me? Excellent. So there's no problem with your neck at all?
No.
Okay, excellent. All right. I'm gonna have a quick listen to your breathing if that's okay. I apologize, my stethoscope's probably pretty cold. All right, if I get you to sit up, is that okay? You
Yeah.
pain at all?
No, that's fine.
Take some nice slow deep breaths. One more. Okay. Good. One more. No pain with deep breathing?
No, nothing.
I'm just going to listen around the neck here. Breath in. Out. Out. Good. You can lay back down there. I notice you're holding a Ventolin puffer. Do you take that often?
Maybe once every couple of days, just especially in the summer and in the winter. I get a bit of a cold.
Okay. Do you take any other medications besides the Ventolin?
I have a white puffer, I Petro something.
Atrovent?
Yeah.
Or, okay. Any steroids?
No,
Any
no
orange
steroids.
puffer? Nothing like that? Okay. All right, so I think the plan is we're going to get you in shortly. When you get in there, you're going to see Dr. Hunter and myself. We'll be wearing masks so we only see our eyes. We're going to switch your transfer over to a table and get a bunch of monitors on you, some leads that are going to go on your chest, a blood pressure cuff on your arm, and a little clip that's going to go on your finger for measuring your oxygen levels. Right after that, we're going to get a mask on your face, let you breathe some oxygen. And then all the medication that's going to put you off to sleep, Dr. Hunter will put through this IV. And from there, you'll drift off to sleep. We'll take good care of you. We'll put that breathing tube in. And the next thing you know, you're going to wake up in the recovery room. Okay? Any other questions for me?
No questions. Just take really good care of me.
We will. And is there any loved ones or anybody in the family room you want us to let?
Yeah, my wife's waiting outside. If you can just let her know that I'm doing okay.
Excellent. I'll tell the surgeon, Dr. Hunter, will be with you shortly, okay?
Thank you.
All right, Mr. Jones, it's Dave from Respiratory, Dr. Hunter here. We're going to take good care of you. Like I said, we're just going to get some monitors on you now, okay? I'm going to go ahead and get the ECG blood pressure and stuff for a moment, okay?
Yeah, that'd be great.
You're going to feel it get a little cold. I'm just going to take those blankets down.
Mr. Jones, I'm just going to put some medication in your IV. Just going to help you, just keep you nice and comfortable and nice and relaxed there, okay?
Sorry for reaching over, guys. DAS right now.
Yeah, just a little bit of gas going in.
Got our IV going on the right side. I'm gonna put the blood pressure cuff. Mr. Jones, you're gonna feel a tight fitting cuff go on your left arm here. It's gonna give you a good squeeze in a second, okay? Cuff might be a bit small. So
Mr. Jones, you said your wife was waiting for you in the waiting room? We'll go and talk to her afterwards when we're done. We'll get the surgeon to go ahead and give her an update, okay?
I'm just gonna cycle that cuff. And we have a SAP probe here. Last thing is just to put a little clip on your finger here. And you're gonna hear all sorts of beeping throughout this part, but that's all normal. Okay, SAP probe's on the same side as the IV. We're all monitored here. I'm gonna go ahead and start pre-oxygenating.
Yeah, let's go ahead and let's pre-oxygenate.
Okay, just gonna turn on some oxygen here. Alright, Mr. Jones, this is just some oxygen for you to breathe, just pure oxygen, okay? Might smell a little bit like Canadian Tire, that's just the mask, it's just some rubber here. Take some nice, slow, deep breaths for me. Big breath in, big breath out. Excellent. Just keep taking those big, deep breaths. You're doing great.
We're gonna go ahead and put you off to sleep, okay? We're gonna take good care of you. We'll see you when you wake up, okay?
Nice, slow, deep breaths. Propofol going in.
Yeah, propofol's in. Do you want to come around? Do you want to do the other one?
Sure, you want to just take care of his eyes first? Let's
Yep.
put some tape on there. Alright. You gonna get another IV sterile like this?
Yeah. Yep. I'll go ahead and I'm gonna go ahead and give the rock.
Looks like he's apneic here, so I'm gonna go ahead and start ventilating.
Yeah, go for it.
Getting good chest rise in the fall here. Pressures look pretty good. Do you have a clock on the rock? Tell me when you want me to go ahead and intubate.
Another 15 seconds.
Pretty compliant for an asthmatic. Easy to bag. Okay, I think we got him here, Dr. Hunter.
Yeah, go for it.
You ready? I can get you just maybe to pass me this while you. It's all lubed up. I've already checked the cuff. Yeah, Cormac 1. Didn't even need a stylet there. Okay, that's good. It's about 20 at the teeth. Confirm.
Yep.
Excellent. Getting chest rise
We got
and
great
fall.
chest rise and fall there.
Okay.
Let's have a quick listen.
So it's a number 8 at 21 at the teeth, actually.
Yep.
Yeah,
Very nice and bilateral.
Ventilator's still set up as it was here. Are you ready for me to switch him over?
Yeah, go for it. You want I can
Yep.
just take that tube in place. I got it.
But he's on the ventilator there now. Call the surgeons in. He's ready to go. Yeah, it's very easy intubation. Cormac 1, nice and compliant for an asthmatic. He did bring his puffer in, so I'll just leave that at the bedside.
Perfect. That was nice work, Dave.
Okay, we got that other IV going?
Yeah.
Excellent. Okay, thank you.